happy to introduce to you Dr. Donghae Kim. He is the founder and president of Vision Care, an international relief organization dedicated to the prevention of blindness, first established in South Korea in 2002. Vision Care initially began as a one-time surgical missions trip to Pakistan, comprising of volunteer medical teams from Myeongdong St. Mary's Eye Center in Seoul, where Dr. Kim is also the founder and president. In 15 short years, Vision Care has now treated over 120,000 patients, has performed more than 17,000 cataract surgeries in 200 free eye camps in 35 countries throughout Asia, Africa, and Central South America. His emphasis is particularly on sustainable development and the formation of networks with local branches in the various countries, including Pakistan, Mongolia, Ethiopia, Myanmar, China, Sri Lanka, Vietnam, and Morocco. Vision Care has recently expanded into the U.S., and we have now formed a branch called Vision Care Service USA. And Dr. Kim was recognized in 2013 by the IAPB for his work as an eye health leader, and we are just really thrilled for him to be able to present some of a summary of lessons learned.
Thank you. Thank you, Lisa, and thank you so much for your attendance and for giving me this wonderful opportunity to present Vision Care, to share our experience with all of you. And my name is Donghae Kim from Korea. I am the founder of Vision Care, an international NGO who was started in Korea about 15 years ago. So pleased to meet all of you who are interested in surgical mission trips, because I'm just interested about more than 10 more years ago and just preparing for something like you to how to do something in global eye health for radio surgical mission. And I realized that the 10 minutes I got just 10 minutes for present for me for the 15 years of 35 countries walk. I think it's so stressful, but I just would like to share our experiences, especially for Pakistan and Ethiopia, and how we were able to develop and to sustain our work in these countries over the year. It was right after the 9/11 in 2001. I just think about why these happen in the country like a Muslim country, something the accident happened in the world, and I curiously visit the Muslim country in that time, and I have a mission trip to Karachi, Pakistan, and there I saw the patient and hospitals and how they working and what the condition is, what is the main problem for facility or the equipment, or what do they do something for the eye treatment in there. During the first time I visit there, it motivated me to do something for the patient in there. So many patients, the less of facilities, something need more treatment in their eyes. And then I came back from the Pakistan. I tried to set up for first eye camp in Pakistan following year of 2002. To prepare for this eye camp, I was able to see the research beforehand for the local facilities, equipment, and what they need for what is they lacking for the consumables. So, and then I prefer something especially for the team, because I want to go there, but there are less of teams in there, no good communication with them, not trained nurses and doctors in there. I take the team with our surgical nurses and optometrists and some of the volunteers together to help me. I think it is very effective for us, the first eye camp in there. Then during the first eye camp, we got something very motivate all of our team, nurses, volunteers, optometrists, and the local missionaries in there, and the patient family too. I feel through this first eye camp, I really being the value of being an eye doctor, and even experiencing the joy of spending my money to the people in there, and the patient and families, and so happy then we would like to be there again the first time the finishing the eye camp. And it was then that we decided to continue visit Pakistan every year 2 times and to use the equipment we had brought and to develop the support eye center in Pakistan and do something support every day. And through this one, we made many friends with the people in Pakistan, including doctors, nurses, and the local peoples and some government office in there. We were able to train the local doctors too and the staff nurses for during our visit and take them from the Korea to something to send them to the India and Nepal to training more skills for the profitable for the working in the Pakistan, because there are some big gaps between Korea and the Pakistan. Every situation is different. Equipment, consumables, something, everything is different. Then we are trying to the doctors at first training in Korea, but send him to the India and the Nepal for training the similar system to working in Pakistan. After working together the many years over the 10 years, in 2012, we transferred the hospital operation and management to the local doctors. We trained a lot already, and the staffs and the managing team. And now we are trying to visit every year 1 or 2 times for the eye camp together with them, and for something for exchange program for the more training for the other doctors and the STEM nurses. And we can support something for the outreach program performed by the local doctors and teams in Pakistan. I think through this work we can understand something more, the other situation in the globally, more problems, more countries need more support, then we have to expand our job to do something more the other country, because volunteer joining together our team understanding more to joining more and more volunteers coming to us, then we can expand our job to cover the other area. Then we learned through so much of the local patient and doctors during our visit for eye camp, like something the small incision cataract surgery in India. We learned the doctors in the local from China, from India, and from Thailand, from Africa. We learn about how they working using their instrument, their consumables, something for usually used for they can available to supplying for themselves. I think it's really interesting to know each other, to understanding each other, working together. To do something more is, I think as a doctor, we can feel something, the friends, families, the colleague, and then we can make a good relations with them to do something more continuously. And we got a good network and vision care together in the local. I think we can expand our job. I think it's not easy to do all the problems to solve by our team or the other small NGO or something, the hospital or training doctors. Then we can expand our job to something globally, to IAPB, like something in the affiliation with the WHO. And through this organization, we can see how they working, what is the real problem, and what is the best way to setting up for a systemic approach in the field. So how to work in collaboration with the local doctors, local training hospitals, and something for the other volunteers too. Then we can see the big picture that I have to visit prior to visit the other country. We have to see the national level of the eye health problem, to talk with the doctors and the medical schools in there. Every country there is something different of the volume, the scale, something, but they have the medical schools, they have the eye department, they have the ophthalmic society too. Then we can contact through them as a doctor to doctor is more easily to communication with them to understand the real situation, what they need, what they want. How can we collaboration in the field and the hospital? I think is very good approaching to visit the surgical mission area to working together with them. I think it is more efficient and more effective result can be possible. And so interesting thing about for our team, we can develop something more for in our group. Vision care ophthalmologist meeting through this one for invite one and the developing country doctor sponsored by the Korean doctor to invite him Korea to have a meeting together. We talk to each other to share our experience, to share something more about their condition, how to develop better. I think it's a good chance for working in the base in Korea that we can make a team in the field. We don't have any doctors or staff nurses in every country certified, but we can work together with them because they know a lot about their country, their system, and their situation. Then this is a very useful meeting. Every 3 years, we got a meeting for the invitation program for vision care ophthalmics meeting in Korea. And we have another group of volunteers, group for vision care nurses and vision care ophthalmic technicians too. They join at first time as a volunteer, but they make their team of volunteer group in Korea and US too, have to working together. How do they support more efficiently to the training program as joining for the surgical team together? Another thing we have the vision care youth group too. We have something volunteer from the high school, the college student join as a volunteer. They do something vision to be an eye doctor or a medical doctor. So many students to be a doctor already. The 3 of them is finishing their training in ophthalmologist, and they're working together with me in my clinic in Korea. I think it's very important for us for working together for a long time. Then we have 5 programs for the short-term mission program and the long-term project like iCamp, glass sharing, and the vision training, and supporting the vision hospital and vision network too. We are working for starting this iCamp, the number for starting in Asia about 137, especially Pakistan, China, and Cambodia, and Bangladesh, Mongolia. But now we can, through our work of 15 years, we can check how they working better, improvement, and changing something for their system. In Asia, there is I think remarkable changing to the training program, for the outreach program, for something more about for the better condition of eye health care. Then we move to the Africa. There are about 1 doctor per 1 million population in Africa there. That's why we do something for the more work now in Africa. Especially in Ethiopia. Yeah. We do about every year just increasing number. Last year we did 30 weeks of iCamp in 35 countries. And we provide glass sharing in the field together with iCamp, because the second reason of the blindness is uncorrected visual refractive error. That's why we have something together with the optician and the optometrist group for providing the glass to the school screening program. This is a number for increasing the number of glasses, and therefore we train the local doctors, something with good partnership together. I think we are all the doctors, but we are more important about our assistant. Surgical nurse and ophthalmic technician is more important for working together. Because we are working very short time, with 1 or 2 weeks surgical mission, I think a doctor cannot do all the things, preparation, screening, examination, the operation, assistant, all the things. It's not easy. That's why we developed the local doctors and our team for the surgical ophthalmic nurse training program. At least 2 or 3 nurses needed for 1 doctor. That's why we developed a volunteer group of ophthalmic nurses. In the field, we developed more nurses training through the iCamp and the 6-month program in Ethiopia for training the ophthalmic nurse training program for how to prepare, how to assist more efficiently, working together with the doctors in the operation room. And I think it's very important for us to make a good team, make an effective and efficient team during the surgical mission, and to help the local hospital to more efficient working is very important. And then good partnership with the local doctor is a key point to working together in the field. And specifically we have setting up the vision care in Ethiopia, the PTC, phaco training courses, and the surgical ophthalmic nurse training course and ophthalmic technician course in the hospital, in the local base. I think the phaco training course is very important for us, because they didn't do routinely for phaco operation in Ethiopia. But this is the point for the local doctors want to working together with us. I think maybe in the future, the Ethiopian doctor may be changing their operation to ECC to phaco, but they want to do training more. How do they working properly? How to managing the phaco machine? But they don't have a chance to learn phaco and to manipulating the phaco machine because there are a very small number of phaco machines in Ethiopia. That's why there is a key point to relationship point with them to do something for the training phaco, to working together with them. I think it's very develop close relation in the ophthalmic society in Ethiopia. I think we did about 4 years, every year 2 or 3 doctors training for 6 months program in Ethiopia. They are our partners in Ethiopia. They do themselves they do train other doctors in Ethiopia by themselves. They do join as an outreach partner to go the countryside in other capital city of the Ethiopian area because 90% of the doctors in Ethiopia is working in the capital city. Out of the city, there is no doctor available to do eye operation in there. And through this work, we can provide them the training and chance to do joining as a eye camp outreach program. We can do something more for charitable operation in the countryside, working together with our trained ophthalmic nurses too. I think it's good idea to working more in the field in the Ethiopian country. And vision care, we have so many volunteer doctors of the 200 ophthalmologists joining as eye camp as a volunteers, but 40% of them is joining more, 2 times, 3 times, 4 times, about 10 more times joining regularly to come every year, the 1 week or 2 weeks. I think it's very important for developing the volunteership in the doctor group. Is very important to do continuously for this program for volunteer outreach program in the vision care. I think it is difficult to beginning. I know about half of these doctors in this room have to want to be joining as a surgical mission trip in the future. Doctors in Ethiopia by themselves, they do join as an outreach partner to go the countryside in other capital city of the Ethiopian area because you can try to do something together with them. I think you can feel something and you can learn through your work in the field with the local doctors and other volunteers together with you. I will encourage for the doctors to join more. It's good for me, good for the doctors and the patient, hospitals and the local training system too. Among my colleagues in my hospital, there are those who have become my doctor due to their experience with vision care, and those who can work for me after volunteering in vision care. Some nurses and staff nurses coming together through the vision care volunteers and working together with me in my clinic. I think my current colleague and staff and volunteers together work with the vision care. I believe they are one of the most rewarding fruit of my 15 years with vision care work together with them. Nowadays, whenever I meet fellow doctors, I recommend that he or she participate in eye camp once a year because I'm sure they would realize just how precious their skills as an ophthalmologist and they would love their jobs even more, and I recommend the doctor try and learn through a surgical mission trip. Thank you so much.